I'm Iris Tullio, student at Liberty University, and this is Crystal Natividad, and she's a registered nurse here in South Carolina. She works in L&D, and how long have you been a nurse, Crystal?
For 9 years.
Okay, and you've had a lot of leadership roles as far as you know?
Yes, ma'am.
And how'd you like that?
They've come with challenges, but we're adjusting.
And worth it, huh?
Yes, ma'am.
And I'm just going to go through and interview her and ask her a few questions, and she's going to answer them for us. We're talking about servant leadership here today. Okay, so Crystal, what do you think that you can do in your leadership role to empower other people in our unit?
I think by trying to have a positive attitude, and when people get sidetracked and have that negativity, to try to divert them elsewhere.
Yeah, that's always a challenge.
And encourage them to just, give feedback to people, but do it in a good, positive way, not with the attitude. And sometimes, maybe not even that day. It may have to be some other time that we do it.
Catch them in a good mood, right?
Yes, ma'am.
What is your definition of a servant leader?
Look at it as somebody who is willing to lead by example. They don't just tell you what to do. They're willing to get in there and do it with you. But also know that there's times that all they can do is help guide you and instruct you, because ultimately you need to do it to learn it.
Right. Yeah, I agree with that. What are your personal leadership strengths? Like when you're leading other people, what do you see as your strengths in your role?
I think part of them is I try to be open and available for people who have issues, and I try to take the corrective criticism well from others, but also try to give them that feedback to encourage them to become better and stronger in what they're doing.
And like in a non-threatening way, so they don't feel like...
Yeah, I try not to bombard them, make it feel like they're failing and doing a bad job, but just give them pointers on how to maybe improve what they're doing.
Yeah, sounds good. What role do you allow fellow staff members to play in collaborating on your decisions?
I try to ask for opinions, like when we're getting together for nurse council meetings, to get ideas of what they think need to be improved on the unit, and we do self-scheduling on the unit. So I try to stick to that as much as possible, and if I need to change their days, I try to ask them ahead of time instead of just doing it. And that way, people have personal lives, so I want to respect that and try to get them to be excited and happy about where they're at. But at the same time, I want to, how would you say it? I don't know. I guess I just want to encourage that in everybody else, to respect others and their time, as well as them being humans. Just, have that common respect there.
Yeah, and just having their opinions heard, it probably means a lot to them anyway.
Yeah.
And for someone to listen to them. So, do you allow for your staff members to meet their full potential? And if you do, how do you accomplish this goal? So that they can grow, I guess.
I do try to encourage them to meet their full potential. I know that, like currently, we have one that is a little slower at grasping some of the things that are going on, and so I try to put her in situations where she's going to have to develop that skill and hone in on it better. But I'm also there for backup. Like if she's unsure about what she's doing or has a question, then I try to make it so that myself or another strong nurse is available to go in there and show her what it is that she might not be grasping, or if she has questions about certain things, then we're there to help her out and give her that resource to let her know, hey, yes, you're doing well, or you know what, this is what we need to try to focus on, or whatever. So I always try to let them do what they can, and then the ones that are more proficient, I try to push them a little beyond what they think they can do to help encourage that furthering of their development in that area.
Yeah, that's good. And then the one that needs a little bit of help, I guess you do it in such a fashion that they won't feel like they're,
not smart enough.
Right.
Yeah. Right. I don't want to degrade them. I don't want to tear them down. I want them to still feel confident and encouraged. But I also want to make sure it's done in a way that they feel comfortable asking for help. I don't want them to ever think that they can't ask somebody for help because they're going to be made fun of or laughed at or talked about. I want them to know that it's a safe environment, and that we do encourage, people to ask for help. That's part of the teamwork process.
And then the things that she is good at, you probably say, probably let her really take that
exactly
on herself. How do you, as far as a servant leader, meet the needs of of individuals while continuing to meet group needs as a whole. So I guess just meeting every individual needs, but as a whole with other people as well.
I try to be there to listen to them, whether it's personal or work-related trials that they might be going through. But I also try to encourage them, if it is a work-related issue, to, talk to that other person. Even if it's just myself or somebody else just sitting there, it's not necessarily even a mediator, but just a bipartisan person there to encourage and make sure that the attitudes stay even keel, the tone, the language, and so that they can learn to communicate effectively with each other and learn to do so in a non-threatening manner. But then I also try to encourage each other to, if they notice something about somebody that maybe is struggling that I might not have noticed or somebody else might not have, to bring it to that person's attention. And if they don't feel comfortable to do so, or afraid that that person may take it in the wrong way, to let one of us others know so that we can try and go ahead and help them out and get that perfected. Because the stronger we are as individuals, the stronger we'll be as teams, and the better we'll be able to help each other. Because we all have strengths as well as weaknesses. And if we build on each other's strengths and weaknesses, we'll better hone in as a team and give better care for the patients.
Very good. We can pause then. Crystal and I are back, and I'm going to continue with question number 6. And that question was, how do you, as a servant leader, meet the needs of individuals while continuing to meet group needs as a whole? Crystal's going to finish that question for me.
Well, what I try to do is, as far as helping meet needs as a whole and individuals, I try to encourage others to do little things here and there. So like for holidays, we try to make meals, we try to do little gifts, just little things that help bring us all together and help us realize that we're humans, that we are people. But also, if people have personal issues and stuff, I try to be available for them to vent to, because sometimes people just need to get it off their chest.
They do.
They don't necessarily need a counselor, they just need somebody to vent it to so it gets out of their system, and then they can work through it a little better. So I try to encourage myself to be available to them and encourage them to, talk about stuff. Don't keep it all pent up inside.
Right, that's a good idea. It's a good way of looking at it. How do you handle suggestions and feedback when negotiating changes and improvements?
I always try to keep an open mind, and I keep telling the ladies I work with, I'm okay with corrective criticism. If there's something you see that I need to work on, shoot me an email. If you don't feel like you could tell me face to face, tell me, and I'm okay with that. I have a hard time though when you come up and you belittle me, or if you call me out in front of a group of people about stuff. I don't take well to that, and I know that's something I need to work on. The disrespect issue, yeah. I'm not very good with, and so I try to encourage them to do things in a respectful manner and in the way they want it. They wouldn't want me to call them out in front of everybody and say, hey, you know what, you royally messed up on this, blah, blah, blah. So I try to ask them to give me the same respect, And like I said, I tell them, if you don't feel like you can say it, or if you're mad at the time and so you don't want to say it, shoot me a text, shoot me an email, But I don't know what I need to work on and fix if they don't tell me. And so I'm all about the corrective criticism as long as it's done in the proper manner.
And it's sort of like in the Bible that says, treat yourself treat others like you want others to treat you.
Right.
So it's kind of
exactly
along those lines.
Exactly.
Okay. And then would you describe yourself as a servant leader? And if you do, can you give an example of your ability to display that trait?
I think I try to be, that's the goal I try to be, because I try to be that person that leads by example and that is there to help you pull the weight, not just put all the weight on you, because that's one thing that I have always had trouble with, is the people who tell me what to do and either can't do the job themselves or choose not to do it. Mm-hmm. And so, if things start getting busy and hectic, I try to pitch in, help out, do what I can. But if it's just a regular, mundane, normal day, then yeah, I want them to do it, because there's other things that I can be doing that is on me as a leader that I can take care of while they take care of their role. So that's the goal of mine. I'm still working on it, but that's ultimately what I'm shooting to try to be, and try to do it in a balanced way, so that I don't overdo for them, but at the same time don't underdo for them.
Right. And I work with Crystal, and I certainly think and feel that she is a servant leader. She gives a lot of herself to others, and she does keep that open mind with allowing people to come to her when it comes to questions and issues.